yes, I also spoke about circadian dysregulation and movement disorders. And this is a relatively novel research direction, which has a substantial potential for development of new interventions that can ease burden of Parkinson's disease and other neurodegenerative diseases, and maybe affect also the biology of the disease, which is less known. While circadian rhythms are really processes that occur on approximately 24-hour basis, and the circadian system is the regulator of our physiology and behavior and aligns us to light and dark cycles, which are imposed to us by the rotation of Earth, right? And emerging body of evidence has suggested that there is a disruption of circadian timekeeping and circadian function in neurodegenerative diseases. I focus specifically on movement disorders such as Parkinson's disease and Huntington's disease. It seems that strength of circadian signaling is diminished in patients with Parkinson's disease, which can affect many processes, one of which is sleep and wake cycle. We know that sleep and alertness is negatively affected throughout the course of Parkinson's disease, and we hypothesize that changes in circadian regulation may be a significant contributor to disruption of these sleep-wake cycles. And even further, studies have demonstrated that this circadian misalignment can affect also other processes such as mood, cognitive performance, even some of the motor symptoms of Parkinson's disease. These studies employed up-to-date both animal models of Parkinsonism as well as clinical investigations in patients with Parkinson's disease, and have spanned behavioral investigations in patients with PD, studies of endogenous hormonal markers of circadian rhythmicity, but also study of clock gene expression and oscillation in patients with really show a loss of some circadian rhythmicity of some core clock genes. So we therefore have documented changes from all the way from behavioral processes all the way into the molecular regulation of circadian timekeeping in Parkinson's disease.